Hello, Facebook friends. It's Carla, your online doctor, with today's Live in 5. Today is Tuesday. It is April 9th, 5:05 p.m. So today we're talking about skin cancer screening. Now, skin cancer is the most common type of cancer in the United States. It is reported that 1 in 5 Americans will develop skin cancer in their lifetime. Now, the most common types, hello Ceciliani, the most common types of skin cancer are basal cell and squamous cell cancers. Now, these types, fortunately, rarely spread to other parts of the body and are usually curable with just local treatment. The third type of skin cancer is called melanoma. It is less common than the other two, but much more dangerous because it is more likely to spread. Most deaths from skin cancer are caused by melanoma. So, what is a skin cancer screening? It is a visual exam of the skin, ideally performed by a healthcare provider, and even better if it's performed by a dermatologist. Now, they check for moles, birthmarks, or other areas that are unusual in color, size, shape, or texture. Now, if you have areas that have growths that have changed in any of these features, they should be looked at. If an area of your skin oozes any type of liquid, bleeds, or develops a crust, it should be seen. A mole that is painful to the touch, a sore that doesn't heal within 2 weeks, a shiny pink, red, pearly white, or translucent bump, or a mole with irregular borders that also bleeds easily. All of those need to be evaluated by a dermatologist. Now, if you are screening yourself, be sure to check for melanoma using the ABCDE criteria. A is asymmetry. One side doesn't match the other. B stands for border. It is ragged or irregular. C, color. Color is uneven. D, diameter. It is bigger than a P or a pencil eraser. And E, it is evolving or changing in size, shape, or color. Okay, so if you've had an area on your skin that looks exactly the same as it has for the last 20 years, that is not something you have to worry about. Okay, so changing, large size, irregularity, bleeding, things like that, make it something that needs to be seen. Now, areas that you need to be looking for problems everywhere. Okay, especially in areas that are hidden or less readily exposed. Okay, so start with your scalp. If you're examining yourself, part your hair into different sections and look closely. Look behind your ears. So you may need, that's why it's good to see a professional. But if you have a mirror or you have somebody who can look for you, look between your fingers, between your toes, in the groin area, under your arms, under your breasts, and in the buttocks area. Okay, so obviously we see the things that are on our arms, our legs, but areas that are less likely to be seen are the areas where things can develop and we may not even know they're there until they've become a size that needs to be addressed. Now, certain people are at higher risk for skin cancer. If you have light skin tone, if you are blonde or have red hair, light colored eyes, obviously blue or green, skin that burns or freckles easily, a history of sunburns, especially ones that blistered, family or personal history of skin cancer, frequent exposure to the sun for work or leisure, or a large number of moles on your skin, and then, of course, frequent use of tanning booths. Okay, so all of those are people who are at higher risk for problems. Hey, Kim, darling. So those are people that exceptionally need to see somebody, but everybody should be screening. So if a suspicious lesion is identified, the doctor might want to send a sample called a biopsy to check the pathology. The goal to screening is to find these cancers early and initiate treatment. With early detection and proper treatment, Basal cell and squamous cell cancers have a 95% cure rate. When melanoma is detected before it spreads, it also has a high cure rate. Okay, regular self-skin exams and annual exams by a dermatologist help people find skin cancers in their early stages. Now, according to the American Academy of Dermatologists, hey Sherry, thanks for watching. There's a program called Spot Me, skin cancer screenings, and they're supposed to be free. Now, they may not be as extensive as an exam that you would get from your dermatologist, but if that's the best you can do, definitely speak to your dermatologist and let them know you want a Spot Me skin cancer screening. Now, if you have multiple lesions or are at higher risk, the exam will require more detail and should be covered by your insurance. So, I encourage you to get one of these done. I didn't get a number that said how often you should screen. Obviously, it depends on your risk, but people in South Florida, people who are exposed to the sun often, should be getting these done pretty frequently. I would say at least once every few years. If nothing is seen on an exam and you don't see any changes, you could probably extend it a little bit further, especially if you're using a good mineral-based sunscreen. But people, do yourself some justice and get it done. Okay, so that's what I have for you today. We're going to continue the rest of this week talking about different types of screening tests. Look back at last week's. I talked about a few others last week. This is my doctor side coming out, giving you some advice. So I hope you guys are having an awesome day, and I look forward to seeing you again tomorrow for another Live in 5.